The goal was to provide emergency financial assistance for people who were in crisis that were directly related to COVID. So the crises involved not being able to pay their bills, but it was COVID related because it was probably due to a loss of job or loss of a part of their employment earnings. So the City of Charlottesville has a program called the Pathways Program, and it staffs a hotline for residents to call when they are needing financial assistance of one sort or another. And so they began to receive a number of calls from individuals, both in the city and the county, who were severely impacted by the onset of COVID. For example, they might have lost their job, or their working hours were reduced, thus affecting their paycheck, and they were struggling with paying their rent or mortgage, utility bills, maybe even child care providers. Given that the county really didn't have the staffing capacity to run the hotline like the cities, what we did was we came back to the county executive's office and asked for funding that we could reserve to help residents, but piggyback on the city's Pathways program. So the county approved $150,000, and that was put in the social services budget so that we could disperse the payments. So the city's Pathways staff received calls and screened them to ensure that the need was COVID related. And then they would send the information on the client and the vendor to social services, and we would cut the check to the vendor. So the three categories that we really helped with was rent, mortgage, and utility bills.
Because of the business closures due to the pandemic, many families and individuals across the county saw a significant decrease in income. That has made it difficult for them to pay the rent or mortgage payments and buy food and medicine and everything else we depend on day to day. We were able to take some money from the county's housing fund and put it towards housing homeless individuals and families in hotel spaces. This could not have been made possible without the partnerships we have with our local nonprofits.
So when COVID hit, we knew we needed to provide social distancing options for people who needed shelter. And working with the county has allowed us to place people who are at high risk for contracting COVID and for complications from COVID in hotel rooms, which has helped us to keep COVID from spreading in the homeless population. Ending homelessness is a public health response, and by being able to provide private rooms and the opportunity to social distance during this pandemic for people who don't have their own homes has helped keep COVID from spreading in the homeless population. So to date, no one that we are aware of in the homeless population has contracted COVID.
ACOH put together a cleaning supply program with funds that came from the CARES Act. When we received these funds, we tried to identify how we could have an impact within our participant families' lives. One of the avenues that we decided to go down was a cleaning supply program. Back in June, we started planning out the program, and the ultimate goal was to meet a need that many of our participant families have, which is to keep their homes safe and sanitary in the midst of a pandemic. So for our participant families, some of whom are low income, having to purchase these supplies would have caused a financial strain for them. And we were able to give away, to date, 289 cleaning supply bags. We have just under 400 participant families, so we're continuing to give away these cleaning supply bags. But we're proud of what we've done to date, and we've heard positive messages from our clients about how it's been helpful.
Since the beginning of the pandemic, our office has given away more than 20,000 face coverings to Albemarle County residents, and we have only been able to do so with the help of our incredible staff volunteers who have given us so much of their time, as well as the cooperation of our community partners. Our goal in doing these free giveaways of face coverings was to ensure that Albemarle County residents, regardless of their geography or their financial status, had access to face coverings in order to keep themselves and our community safe. We hope to continue doing periodic distributions, and we look forward to your help in making that happen.
Because we realized that the individuals, the residents at these long-term care facilities were at risk. And so with my connections in regards to Humanes and all the other ancillary work that I've done, I have a relationship with those nursing homes, and building on that, we implemented some plans for change and worked with doctors and nurses throughout the area, as well as UVA, and we figured out a plan of action to prevent the spread of and proliferation of the virus into the facilities.
One of the responses we had from economic development was to create a business continuity plan. We went from helping businesses grow to helping businesses survive. We changed the timeframes for when their taxes were due. We created access to capital, and then we educated the community on other opportunities for business support. Economic development used to focus primarily on big business. When COVID-19 hit, we had to pivot and change our strategy. We created a microloan program for any existing local business that met the qualifications. The county provided funding to Community Investment Collaborative, who then administered the program. The general idea was to get capital into struggling businesses' hands as soon as practical. Well, they could use it for anything like paying rent, keeping employees engaged and employed, and or just survival. When we surveyed the community businesses, we learned that they were unaware of opportunities that existed outside of our region. Our team thought it was important to bring all that information together in one location and then spread that out through our community so that businesses were aware of all the opportunities that were present.
As an organization, we knew it was important to keep the community going. So what we wound up doing is making a decision to stay open even while we were trying to figure out how to keep our customers and our employees safe. Because we weren't sure what we were facing, in community development, we implemented some new procedures, both for our inspection staff going out in the field, and we implemented new procedures and physical distancing barriers here within CDD, in our lobby in particular, to help keep our customers and our customer-facing staff safe. We also implemented emergency procedures to enable us to support our businesses staying open during this time as well.
It has greatly impacted our interaction with customers. Typically, we were able to serve our Spanish-speaking residents through face-to-face interactions, as they were able to transmit their payment details with paper. Going contactless, it was a big challenge, and we found that we were not going to be able to support them properly without bringing in translation and interpretation services. So we contacted our fellow friends in the Office of Equity and Inclusion to connect us with interpretation and translation services, and they were amazing partners with the Department of Finance and Budget. And so we were able to bring in a few translators and interpretation representatives who actually stood outside in front of our building with our colleagues and staff to help our residents.
Yeah, COVID-19 has actually had a huge impact on the YANCEY operations as it was strategically planned. It had a serious impact on the operations, even the food pantry, which is still operating, and they were able to do curbside as other food pantries did. And just it kind of rose up that we had people that had always come to YANCEY to sit in the parking lot to maybe check a website or something. They usually stay 10-15 minutes and they're gone. But I noticed that there were a few cars that were coming that were out there for an hour, and a couple of occasions 2 hours. It's like, what are those people doing? And then I finally started like just, when I was leaving, I was like, how you doing? But, what are you doing? And I found out that, they were teachers or professional people that was trying to do their services without going into the office or couldn't go into the office. We provided a needed service in the community without compromising the overall standards of safety that the organization had put in for facilities. This organization actually took the time to think it through and say that exceptions are warranted in some cases, and the citizens of Southern Albemarle, are benefiting from that, as an available service.
So we recognized that with all this craziness going on in people's lives and trying to balance the work life, their personal life, the work life, and stay at home with the kids, we felt that if we could find a way to keep these parks open in some fashion, even if it was a modified version, it could help people kind of decompress, escape, go outside, enjoy the many offerings that the parks have, but be able to do so and feel safe about doing so. It was a collaborative effort between our parks team, the county executive office, as well as IMT. And through those discussions, as I mentioned, of trying to see how we could possibly keep these facilities open, that's where the Park Ambassadors program evolved. The Park Ambassadors, we have a total of 16 at 7 different locations. There are generally 2 at each location, but we place 3 at 2 of our larger regional parks, Dardentow and Walnut Creek Park. Their role is to engage, to educate, and observe. And we felt that it was absolutely essential, almost critical, that we keep our park facilities for the quality of life and mental health of our community. Take it to keep our facilities open. I will say this, that with over 900,000 visitations, our park ambassadors have made a lot of new friends.